Hi, I am on air. We've gone live, and I'm just really glad that everything came together today. And I've got this space to try and connect and figure out how best I can support you as an expecting parent going forward. I'm Christina. It's very nice to meet you virtually, and I'm gonna basically take you through why I got here and why I do what I do in trying to support parents in empowering them, connecting them with community, and also giving them as much education, especially when it comes to evidence-based information, and how that can help them when walking into a hospital birth situation. And I firmly believe that all communication starts now. In that moment when you realize that you're gonna have to make some very heavy decisions coming up in the next months, days. I know you all are kind of on a spectrum of due dates. So I'm gonna do my best to meet your needs. And if anything comes up where I'm going too quickly, or if you'd like more information, stop me. You can definitely put something in the comments to the right of your screen, it should be. I've also put a couple questions down in topics. So there's a question in the questions button right underneath the screen. There aren't any polls right now or analytics or information, but I will be updating that as we go through the series. So this series is going to be 4 classes long, 1 a week on a Wednesday evening starting at 6. But if you can't stay for the full session or you're going to be late to a session, always know that it will be here in this Crowdcast platform for you to view when you're relaxed and ready to take in all of this information. So the reason why I got into this is I really stumbled into it. I was attending a couple of near and dear births to my family and friends, and then had a friend tell me that I should probably be a doula, and I didn't know what a doula was. So I did a lot of research and found out that a doula is a woman helping another woman through childbirth. So with that, I needed to get more information. So I went and trained with DONA, and then soon after that, I decided to go and train with ICEA to get a full understanding of what we needed to bring to parents in order to make sure that they felt confident, that they had a voice and a connection with their medical team. The reason why I focus on that hospital birth perspective, and more power to those that are having the home births and doing birth in their own way outside of a hospital. I think that's beautiful too. For me, I come from a background of working in the treatment sector, and I would read a lot of applications, mother's history with their birth story. And it always didn't go to plan on what they were hoping for. They felt like they lost their voice. They felt like they trusted these professionals and didn't get a chance to really put their perspective on what they wanted to happen on that day of labor and delivery. So with that, I decided to kind of merge that experience along with this birth experience with my friends and family, and figure out how I could put myself into a position of just broadcasting information out effectively and efficiently. So this is why I'm typically now in your home, and you're watching me on a screen. Could be a cell phone too, I guess, in a car, I don't know. But hopefully if you are pregnant, you are comfortable, that you're sitting in a nice space and feeling relaxed and in tune with the material that I'm going to be presenting for you. So another disclaimer right before we begin on content is that I am not a medical professional, and everything from my perspective, I am going to give to you in a way for you to make a decision. The most important thing for me at the end of the day is making sure that a mom feels like her voice is heard, a dad or partner, that they feel connected with mom through this experience, and that everybody is on the same page when making decisions ahead of time, and feeling confident. It doesn't have to be what another mom's story is. It doesn't have to be based in fear. It can really be empowered to know that this is what I hope for, but it just might not happen that way. And I am going to be ready for any decision that comes my way in the most vulnerable moment that I have. And it is really, honestly, the most beautiful experience to watch a couple experience a baby come into this world. And if you're a single mom out there, making sure that we figure out how to get you the right support, because you don't have to do this alone. And I have resources that I can connect you with as well. So for everyone watching, feel free to email me anytime at tribedoula@gmail.com, and I will be happy to personalize any information that you might be looking for. So going forward, and this is my first time using a slide show at the same time as doing the webinar, so I am hoping that I am not fumbling around too much. Bear with me. So I really, really want you to just keep it simple. Everything about this process is keep it simple, but it's all based in communication. So today we're going to go through the topics of anatomy of pregnancy and the progression of labor and delivery. And like I said, at any time, just pop in a comment if you have a question, and I'll get right to it. The other piece that I'm very excited about today is that we are going to have a guest speaker, and I'll introduce her a little bit later on. And she is going to help us with understanding routines in believing before we get to the day of labor and delivery, or days of labor and delivery, that you are healthy and that you are strong and that you can do this. I think there are some brilliant pieces of information out there on the web, in videos that you can get through Netflix and things like that. I think sharing experience with other women is profound, but I also think that you have to figure out who you are first. What is your strength? What brings you and your partner together? Why do you connect so well? Because that is all going to be pulled together in a very heightened moment of hormones, endorphins, feelings. And if we can unite you at this point in time, we will end up having successful memories, looking back on your story with strength, and that you're not in regret, but that you feel empowered with the decision that you made. And hopefully you're holding that baby to your chest and just smiling and probably tearing up, and everybody in the room will be in awe. And it will be absolutely magnificent. I am known to be the doula who cries at every birth. I try to stay out of the way, but I typically have tears in my eyes, and then parents are laughing at me because I get a little bit overwhelmed with how magnificent that moment is when that connection happens. So again, we're going to go over many different things through this series that are going to support you in believing your own strength, mindset building, physical strength building, all of that kind of stuff. We're going to talk with medical professionals, therapeutic support, and my dear friend today who will be joining us with really daily routine, making it simple and getting used to it now so that it's second nature on the postpartum side. So the next topic that we're rolling into is anatomy. Partners, dads, partners out there, if you're wondering why mom is feeling a little uncomfortable, it's because this is what's going on internally. I love these images so much. So if you're looking at your screen on the left, we have before birth, or before the phase of having a baby in the womb. And this is a very full womb that you're seeing here on the right. And if you want to take a further look at this later on, like I said, this will be up and for you to view at any time. So I'm going to go to the next slide. And this is going to show you a little bit more of how that baby is within the uterine wall and the ligaments, and the great positioning of head down, face back, butt up, this is a great position for that baby to nicely slide through the birth canal and end up on mom's chest. So this is a little bit of the anatomy piece. You're also going to see some of the ducts here that are full and ready to produce and lactate to provide for your baby. And we'll go through what happens internally with your chemistry in order for that to happen. And typically that gets flooded. It does develop while you are pregnant, but it will also really kick in right after your placenta is also delivered. So we'll be talking about your first delivery of baby and your second delivery of placenta as well. So looking at this anatomy right here, I'm about to bring out some of my favorite items. I laugh at myself because I got really, really excited when this came in the mail when I first got it. So first off, here is your uterine wall with your cervix at the bottom. Yes, it is knitted. It's a little bit odd. It looks like an odd shaped beanie, but this is your uterine wall inside. Right now, your cervix is tight and it is long, and it is going to need to thin and shorten in order for a baby to come out. So at full term, 40 weeks, is when we're hoping all of that really comes into play. Now, with your due date, please know that that is an estimated time of arrival. So what I highly recommend for you is to not focus on that one day, that you're going to make this an experience, that the day before that date, you're not going to stress. That day of that date, you're going to celebrate that you got to that date. And if you have to endure days after and making yourself comfortable through those 40 weeks, 41, and some moms even take it to 42, that you are going to celebrate those moments. And partners, dads, you can really help out in those moments as well in figuring out what are comfort measures now that she really likes, positions of sitting on furniture at home, maybe getting a birthing ball and practicing some birthing positions before that day comes. So we'll go into that with Dr. Kayla, who is going to be joining us on, I believe, class number 3. But right now, I'm going to take you back to the slides. So now we see where baby is positioned inside, and I'm going to show you this. I was very confused with these pictures and how everything really came together until I got this item. So this is my baby. And my baby is currently in the double layered membrane of your amniotic sac. This is keeping your baby within the amniotic fluid that is flowing inside. When your water breaks is when the amniotic sac opens up. Now baby will still stay inside, but this amniotic sac will open once your cervix has, typically once your cervix has shortened and thinned, and you are fully dilated. Fully dilated is 10 centimeters, and I'll give you reference to what that looks like and how they measure that along the way as well. So once the baby comes, this is your first birth. So baby will exit. Hopefully we have baby facing back, head down, butt up, and coming out of the sac, the baby will then come to mom's chest. This part of the sac and your placenta will then have to be detached. So dad, partner, this is your moment to shine. This is when baby is on mom's chest and the doctor will say, would you like to cut the cord? All cords look different. They could be short, long, thick, all different kinds of things can happen with a cord, and they can all be healthy in the different versions that they come out as. And we'll go through in your birth plan what your choices are with cord blood banking, donating, and delay of cord clamping. But for right now, what it would look like is partner, dad, would detach the umbilical cord. Baby remains on mom's chest at that time, and we continue with the golden hour. The next part is the birthing of the placenta. This is your placenta. So this is attached to the top of your uterine wall. When it comes, it will come about, it can come anywhere within a couple minutes to up to 30 minutes of delivery after your baby. This will detach from the uterine wall and proceed through your canal and birth out. And sometimes it's not something that a partner or father is looking forward to seeing. For me, it is another brain in the body. This piece right here is the brain that created your child, and it created life. And I know that's hard to wrap your head around, but I find it very significant. And there are many different things that people like to do with their placenta. Some say, no thanks, you can keep it. Others like to take it and put it into pill form, possibly a smoothie, and take all the nutrients that are within the placenta and utilize to nourish their body on the backside. Now, that is up to you, and I have resources for those that are experts in that area that can further your education on what you would like to do with your placenta if that's something that you would like to entertain. So once it comes out, it actually goes into like a Tupperware little item within the delivery room, and you really don't see it after that. It's very quick, and it's delivered typically, like I said, within a couple minutes. I usually see them within 5 minutes, 10 minutes, but up to 30 minutes. If it's more than 30, you're gonna need to have a conversation with your doctor on the front end. If my placenta does not get delivered within 30 minutes, what do you typically do? And knowing what your provider does on the front end will prepare you for if something like that happens in real time. And so that you already know what their actions are going to be, that you can trust in the process of whatever practice they are going to be using. And at the end of the day, you understand what happened to your body. So that is my demonstration of the amniotic sac and the baby. Now, when I tell you, I brought this slide up a little bit soon, but it is your pelvis. So this is mom's pelvis. It's tiny. I know, it's so cute though. And in that slide, you're gonna see the ligaments in blue are those that can be flexible. So mom, this is why we want you moving. So we'll go through this again, but once you get into that phase of labor, we really want you moving every hour. We want you using the restroom every hour. The reason why is because the bladder gets in the way, and we need that to be on empty, so there's as much room as possible for your baby to come through. These ligaments are also capable of birthing very big babies, average sized babies, little babies, all those kinds of things. So trust in your body that you are creating life that can flow through your natural anatomy. So optimum placement of this baby coming through is head down, face back, and you will wiggle through. The movement every hour and getting you in new positions allows the baby's head to wiggle past this tailbone right here. Now, it will take time, and it is not something to be rushed. It is something to prepare for the marathon of life. So we will go through different birthing positions that are going to help you have the most success at getting that baby all the way out through all the stations, and we'll go through that as well, so that that baby is safe and sound on your chest. Okay, I'm going to continue on. If you have any questions at this time, please throw it in the chat. If not, we'll talk about it later. I'm always down for that personalized email, as I said. Let's see, next slide. All right, so a couple of resources that I really like to understand how to prepare your body on the front end, not waiting till the week of, the day of labor and delivery. Dr. Kayla Ambert will be joining us for class 3, and she is a chiropractor / nutritionist. She's an overexceller in life, and she is going to go through how she gently prepares mom's pelvis, the rest of her body, to relax and release. This is not something that I'm telling you that you need to do. This is an option for you, and it is just a way to learn how your body can prepare for your day of birth. The next piece is of information is spinning babies. If you're into online education, where we are right now, Spinning Babies has a great option for you to go through and learn the different positions to rest your body in currently, so that your baby has enough space within your womb to get into its natural positioning to come out into this world. So like I said, it's all about making space, and it's about getting you comfortable and allowing that head to drop down and come out. And the piece when people are talking about back labor, let me back up a little bit right here. Back labor is typically when you have the face forward coming through the pelvis, and you're getting that bone-to-bone interaction of that backside right here through the tailbone, and that is not comfortable. And there are some definitely uncomfortable moments for moms that are trying to endure back pain. The number one thing, do not sit in bed. If you have back pain, you must keep moving, and we'll teach you positions in order to get your body ready if your baby decides to turn that way. But the optimum potential of making the face back is getting your positioning ready right now. So let's move on. And our next slide. All right. Now, I don't think you're a brat if you do this, but it's my way of remembering what to teach parents in making great decisions for themselves. Benefits, risks, alternatives, and time. Be a brat. In any moment, if that's your doctor's office visit and you have questions, if they give you some kind of information that puts some fear in your mind or anxiety, really reflect and lean back into the brat method. So asking them, okay, you're telling me this information. What are the benefits of us doing this procedure? What's the risk of this procedure? Are there other procedures that we could maybe try that are less invasive, less risky? And is there a chance that we don't have to do this procedure? Looking for those alternatives. And the best one is time. When do I need to make this decision? I understand that a white coat coming into your medical setting is overwhelming sometimes. And it's even been shown that you can get that high blood pressure, and your body reacts chemically to that doctor being in the room. And we want you to trust your doctor so much, and the practice. So some of you may not be able to know exactly who your doctor is. Some practices allow you to go and meet all of the doctors before the day of delivery. If it's a midwife practice that has a rotation as well, they may allow you to meet your midwife before you enter the environment of the hospital. I do recommend, if you can do that, that's great. But you got to figure out ways to trust your medical provider on the front end right now before we get to the hospital and it's time to go. So the person that's going to come on to help us with that conversation is someone who deals with it day in and day out. It's my dear friend, Dr. Courtney Martin, and she will be joining us for our next session next week. And you can ask her all kinds of questions. What's okay to say to your doctor? What's not okay to say to your doctor? When can I change a doctor if I don't like a doctor, which by the way is anytime, even when you're in delivery, and figuring out the language that's going to make you a solid team and capable of enjoying the process of bringing a baby into this world, because it can be enjoyed. I have laughed with moms and laughed with dads, singing songs throughout the hospital. We have had tears of joy, great storytelling, Contractions are nothing to fear. You are strong enough to endure them. You just have to be reminded at some points that you will get to the other side. And so that's where dad and partner, we are going to work on a couple of techniques as well throughout this series on keeping mom centered and figuring out how do we channel her best strength in her moment of vulnerability. It is not a moment of weakness, because you will see she is stronger than anything on this earth when she is in that moment of breathing, being centered, believing in herself. And when you see that baby come into this world, it is magnificent. I cannot tell you anything else that is as profound as that moment in realizing her strength at that time. So again, I want you to keep this, maybe you put it in your notes or whatnot, benefits, risks, alternative, time. Keep it in your notes on your cell phone. When you get information from a doctor, even while labor and delivery is happening, know that you always have the ability to ask for more time. When do I have to make this decision? Can I have an hour? Can we have 15 minutes? Can you leave the room so that we can just discuss by ourselves? It's a great method for you to center yourself, get calm, and make the best decision for your family. Moving forward, fetal non-stress test. This typically happens 28 weeks into your progression of being in that prenatal stage. So you're rounding the corner of seeing 40 weeks, and you're going to have to go in. Now, this is kind of really an exercise for you to get used to some of the uncomfortable measures that happen within the medical setting. So you're going to hear about the belts and the monitors. And some hospitals, when you go on a hospital tour, these are questions you're going to ask. How do you monitor the baby heart rate and all of that through these tests that have to go on within this medical environment? Most of the time, what I see is 2 belts that go around mom, 2 monitors that stay on top of her belly. It's not the most comfortable thing. So our goal is to get you most relaxed and in touch with your body and moving. These monitors really inhibit that from happening. So if you are healthy and you have the go from your doctor and you can ask this, if I am cleared, clear bill of health in delivering my baby, I would like to only be monitored 20 minutes per hour. Typically, they will take 20 to 30 minutes of monitoring and then allow you to move again. Get in the shower, the tub, walk the halls, sit on a birth ball. All of those things need to be happening so that we can shift that pelvis to let that baby drop down and come out in the best way. The next piece, so if you have any questions about that test, I can go further into that. And we can also cover it a little bit with Dr. Martin next week. Relax and release. Like I said, biggest thing that we've got to do is relax the mind, relax the body, and everything else will flow. We talked about your cervix, but we have to talk about cervical ripening. And I've got a couple slides, but I'm going to take you back to the beanie right here, and this being your cervix. We're going to talk about different hormones and endorphins that are going to kick in to help you have success naturally with your body. And the biggest thing is trusting your body. I forgot to put a note in there. Keep it spicy. It's not just your food. What I mean by keep it spicy is the pheromones that allowed you to get pregnant, the connection that you have with your partner or a husband is what is going to get you your baby out. So all of your partner's pheromones being close to you, and if that's kissing, if that's hugging, if that's massage, those are all going to help you with relaxing and releasing your baby out. So keynote, lots of kissing through contractions. It has actually been shown that it will decrease levels of pain with that connection happening. It sounds silly, but it happens and it gets pretty romantic. And sometimes as a doula, I just have to sit in the corner and allow this loveliness to happen. So please don't be shy. That connection is everything. Walking, lunges, hills. We're going to talk with Erin Kennedy Salvetti in about 15 minutes about her perspective on getting you ready on the prenatal side, transitioning through the postpartum side with physical activity. Also daily routines that are just healthy, but really focusing in on how do I strengthen my body now to endure the marathon of labor and delivery in a very successful way. Let's see, I've gone back. And yes, so we talked about intimate connection and kissing. Oxytocin, your love drug, right there. It's going to give you a sense of calm, reduce anxiety and fear, increase confidence, promote bonding between the two of you. Beta endorphins decreases pain perception, moderates levels of oxytocin, which is your love drug, and send mom into a dreamlike state. And to say a dreamlike state is beautiful. I've never seen the most beautiful, until I saw this mom. The toilet is going to be your best friend, mom, when you are going through this progression of labor. It's a nice place for you to retreat away from the medical setting in your other room. Typically, medical professionals do not go into the bathroom. They let you have your privacy in there. And when you can have your privacy and be with your own body and mind, magical things happen with your own strength. And the toilet gives you a spot to feel like you can release everything. I'm going to say this, and you might have some concern around it, but we will continue to process it. Everything must release out of your body in order for your baby to come into this world. That is all kinds of fluids. So if you're nauseous, throwing up is a great sign that you are getting close to delivery. Flushing out all different matters throughout your body is going to help you create space for your baby to move downward and out of your body. So all of those things need to happen, and the toilet seems to be a great place to be in order to feel comfortable and efficient to make that happen. It also allows you to open up your hips and rock and dance right there. And like I said, the most beautiful thing was this dreamlike state this mother was in, and she had very long hair. And she just began to really breathe out what was internally building up. And she looked like, I can't explain it more than she was like a wolf mom. Like she just was very in touch with her body and was letting it all go and just rocking back and forth. And her baby was born very soon right after that. So all of these things that are flooding your body at this time really do have significant, you can see it. So as a partner, you can see when these different hormones and things are, endorphins are running throughout mom's body. You just have to pay attention. So before we get to catecholamines and paying attention, I will highlight, try to keep the TV off if you're in the hospital room. The best thing to do is talk about your stories, how you guys met, what makes you happy together, some of your best travels, silliest things that have ever happened. That connection and the pheromones being near you is what's going to get your baby out. Watching something on Netflix might relax you a little bit. Everybody's different, and if that's your choice, that's a great thing too. But I do highly recommend for mom and dad and partner to connect in that moment. It's a very short period of time, although it feels long when you are progressing through your labor and delivery. But it is short in the increment of a lifetime. And to have those memories built and to remember her moments of strength and to remind her on the backside, dad and partner, is the best thing you can do for her mental health. She's not going to remember everything. She has to drop into that dreamlike state in order to endure the change within her body. And so with you remembering moment by moment and giving that back to her allows her to remember her own strength when she's on the other side. So catecholamines, alertness and focus, strength, milk production, this is all kind of coming in for you to be a protector, you to take care of your baby and feed your baby. All of a sudden, you're a mom. You're a mom right now, just different. It's time to take care of your baby and comfort your baby outside of your womb. And so this is going to happen as well. Prolactin, milk production, like I said, you already have some of that going on right now as you are growing your baby internally, and it's also ripening within your breasts, but it's really going to heighten once your placenta is released. Okay, so I'm going to do a little acting right now. Don't judge me, I'm not a professional, but this helps for dad and partner to watch her, to understand her, to know when to make the call when she can't. Early labor is going to be dilation of 1, and now they've changed it to 5. So 1 through 5 is early labor. Typically what you see with early labor is that you're going to have a contraction. It might last 20 seconds, 30 seconds. It can last even longer. And then you're going to have a point in time where it's a rest period. Could be 10 minutes, could be half an hour. I don't know your body and how it's going to react, so I can't give it to you exactly. But you're going to have space and time to process that you had a contraction and that there will be another one that comes, and you will take the wave of the contraction and let it be on you. Tell yourself that you're stepping into it. Dad, you will be there like this. As a partner, you're going to want to hit that button and time every contraction to keep a nice recording so that you know exactly when to go to the hospital. Try not to have that watch in front of her face. Try to feel it internally within your body and kind of guess in those early stages of labor what's happening. There are great apps out there that are going to help you. Dad, partner, please download iBirth or an app much like it. And it's going to help show you some labor positions that you can help her get comfortable in. It's going to remind you that you have the ability to mark her progress going forward with all of her contractions. And it can give you a printed out sheet. Send it to the doc if you have questions. Send it to your doula if you have questions. It's a really nice thing to have on your phone, and it feels like you're in action doing something. Just remember, don't hold it in front of mom's face. What I do highly recommend is, mom, have a voice. Tell dad or partner, I am stepping into my contraction, or have a signal. Just a finger, hand, tap him on the shoulder and hang on him. Whatever that looks like, let your partner know that you're stepping into it, because you will tell yourself, I am stepping into this contraction and I will be on the other side. I just need to breathe through it. Believe in myself. It will heighten and it will go. And you will let it go and you will walk it off, and you might laugh, you might be hungry, and you might cry, and you might do all kinds of things, and anything goes, and that's okay. Because it is the most vulnerable moment in life, and it can be enjoyed to the fullest. Active labor. Active labor is going to look like 6 centimeters to about 9. It's going to be quick. You are going to have a very shortened period between contractions. Mom will step into that dreamlike state a lot of the time, feel overwhelmed maybe. Not so much of a conversation in between the contractions. It still could happen and does happen, but you're going to see one after another. And this means baby is right around the corner from coming. Taking a nap in between contractions happens. 30 seconds, a minute, 2 minutes, 3 minutes, whatever you can take. Please try and get some sleep. Dads and partners, I would also recommend that in this early labor section, as well as active labor, early on active labor, that you consider taking a nap as well. You are going to be so much help and just so needed on the postpartum side that we need you to feel like you have the energy, that you have not depleted yourself, and that you are there to be solid for mom once that baby comes out. She's going to need a lot of help. Show's not over, it just begins. So please kind of figure out how you can get some support. If that's a doula, we'll talk about that. Not everybody has a doula, and that's okay. But if you would like one, they are very supportive, especially for giving partners and fathers the opportunity to rest, to run a couple errands, to make a phone call, and never leaving mom alone. Please make sure that mom is never left alone with a contraction. She is in this state of need of support. And like I said, not of weakness, but this is the moment where she needs to have somebody to rely on and to process, if that's talking, if that's just holding her while she maybe cries a little bit, if that's communicating, hey, I'm thirsty, hand me my water bottle. She needs to have that partner right there with her every step of the way. And so having somebody come in and alleviating dad so he can get that rest is a great option through labor and delivery as well. So the transition, you're going to see that at you're basically at 10 and 10 centimeters dilated, and it's go time basically then. So once you get to that spot, it is quick and it happens, and you will know that it is a production is about to happen because lights come on, tables are wheeled in with all the different supplies that the doctor will need, and people start putting on scrubs, and you know the show is about to go down, and it's so exciting. Even if you're tired, you light up again. And I highlight that moment with typically a song. Parents put on, make a couple playlists, make something that's real tranquil, make something that's really funny. I had a mom that really loved hip hop. It got really hip hoppy right before she delivered, and the room was full of energy. Music can change the tempo of your room, and we'll go through that with birth options as well when we get to that series, but keep that in mind. 3-2-1 versus 5-1-1. I want you to talk to your doctor. So 3-2-1 is really looking at, sorry, I'm fumbling with my slides. 3-2-1 is every 3 minutes for 2 hours, you've had a 1 minute long contraction. 5-1-1 is every 5 minutes, you have a 1 minute long contraction for 1 hour. Depending on your medical provider, have a conversation on when they would like you to come in. I don't know your body and I don't know your medical history of your family. So if you're known to come from women who birth very quickly, your medical provider might have a suggestion for you at when they would like you to come to the hospital. Typically, from a doula's point of view, we are trying to keep you at home as long as possible so that you can labor within your own environment and be as comfortable without monitors and the ability to relax with your mind, body, and everything else. And also that it's, when you're looking at bacteria levels, the safest place to be is your own home. When you enter a hospital, you have other people's bacteria around you. So if you can stay within your own environment, it's always a great thing for you to just be healthy and sound within that. So moving forward, dilation. Let me see if I can switch this right here. Dilation is measured by fingers. So if you have a nurse or a doctor with thicker fingers or thinner fingers, it is going to have their perspective on what your dilation is. They are very well trained, so they understand their body when doing these measurements. But for the vaginal exam, know that it might vary if you have a different person doing the exam. And you're going to see down at the bottom right here, your cervix and the shortening of the cervix and the thinning of the cervix and the ripening so that your baby's head is able to come and drop out through its station to and through your vaginal canal and end up on your chest. So that's kind of what it looks like all right there. This is the dilation and measurement. Partners, please take the vaginal exam very seriously for mom. It is uncomfortable. We try and really get mom to have the least amount of vaginal exams once entering the hospital. Yes, it does show signs of progress, but sometimes it can inhibit her progress if she's looking for the number, if she's reaching to get to this next level, instead of being in the moment and allowing her body to absorb what it does naturally in its own time. The other reason why we try not to have too many vaginal exams is because you are having another human's hand enter your womb, your space of your baby and your own vaginal canal, creating the opportunity for bacteria to transfer. And we really want to keep it as clean as possible so that we aren't looking at infection and fevers and things like that. So, like I said, partners, please take the vaginal exam very seriously. Moms, when you know what's happening, you can tell your medical provider, this is uncomfortable for me, so can you please talk me through this? It is invasive, so if you've had any trauma in your past, if you are modest with your body to an extreme level, please know that about yourself and know that you are allowed to ask, can you please talk me through this and let me know what you're going to do before you do it, and to breathe. Breathe when they are measuring your body, because that is definitely a lot of pressure and uncomfortable moment. So partners, hold hands, remind her to breathe. This spot on the face right between the eyebrows sometimes is a great place to just touch and tell her to relax and let her face go and relax down and let it drip off of her shoulders and drip off of her body. And she will be able to then channel her breath to get through that uncomfortable moment. Next slide. Cervical effacement, we kind of just went through that, but that is another picture of what the thinning and shortening of your cervix looks like. And, whoop, went too far. Stations. Okay, so I love this, this slide, but it's not going to function for you right here. I've put the link to this video that can be found on Facebook, and watching it, it will show you what they're talking about. So they're going to say you are so many centimeters dilated. Your effacement is what your cervix is doing. So that ripening, it's thinning and shortening. So 50% means you're halfway, 100% you're fully open. These stations is where your baby's head is. And when your baby is coming down, what that looks like. And this video in that link is a beautiful perspective of how that all happens. So I highly recommend after this that you take a look at it and just kind of understand what is going on with your body or your partner's body. And let's see. So at this time, I'm very excited to introduce our, let me actually see if we can click out of this to bring her on. She's extraordinary. Erin Salvetti is our expert guest today, and I'm inviting her on the screen. Yes, I am sure I want to invite her on. Sorry, there's so many buttons to click, and I just want to make sure that I do it correctly. So Erin Salvetti, college friend of mine, lifetime friend, going forward, and she'll never be able to get rid of me. And I asked her to be my expert today for today's series class. It means so much to me. And she is an expert in everything to do with maintaining a healthy lifestyle on a daily basis. And let me see. Yeah, she should be tuning in any minute. I know she was watching. So she is an instructor that has created her own, she says she's trying. Sorry, we just got a text. Let me see if I can try and invite her on the screen one more time. Let's see. She's still trying. Technical difficulties, but we'll get through it. Her expertise is really in getting routine for you to make healthy choices right now through your pregnancy on that prenatal side, and looking at that transition to the postpartum side, getting yourself back in the zone to understand that you have the ability to accept everything that's going on with your body right now, strengthen it, hone into the changes that are happening on a daily basis. Remember to stay hydrated and keep up your physical activity. It is said that your physical, accepted and connecting. Okay, we're accepted and connecting. It is said that moms that have a workout regimen before getting pregnant are capable of maintaining that through pregnancy. And so you aren't sick, you're not weak, you are capable. It is uncomfortable, I understand that, especially through the summertime with the heat. So you want to stay hydrated and you want to pick your environment that you're going to go and have that physical activity happen. So maybe that looks like prenatal yoga. Maybe that looks like a bar class that understands the need of your current situation that's going on with your body and the growth of your body. And let's see if we can, we're still connecting. I hope we can connect. But Erin created this bar program and teaches instructors around the world how to channel the mindset, the soul, the body, all in one for their clientele to maintain this healthy, active lifestyle on a daily basis. And she is also known to be an NFL cheerleader back in the day. She was basically raised within a health fitness family. So everything that she's kind of taken in has come from the moment that she, I would say, was conceived within that womb, and makes it happen today. Erin, I'm not sure it's going to happen. Let's see. Says it's trying to test, but I don't see. Let's see if I can try to invite on the screen again. I'm sorry for this inconvenience. Let's see if we can remove it and try again. Yes. Okay, we try it again. Okay, so if Erin joins us or if Erin can't join us, I highly recommend for you to visit her on Instagram or on her blog. livinglately.com is her blog. All of this for her background is in the comments as well. And on Instagram, she's @livinglately, and she really promotes a daily active lifestyle. So for you on that prenatal side, I want you to engage with your community. I want you to reach out to different sources that are helping you mentally get ready, if that's meditation, if that's hypnobirthing. This format is birth education. Hypnobirthing is also birth education, but a different platform of really conceptualizing that mindset and breath and connecting with your body to allow the baby to flow out of you. I like that as well. Another piece is that,
oh my God.
Happened. Yay!
Oh my gosh, I kept saying, I'm here, I'm trying.
Everyone, I swear, I have this friend named Erin, and she's fabulous.
That was a phenomenal intro. It's a good thing you knew me for a long time because you could just keep going with it. Oh my gosh.
I do. I know her inside out. She used to be my spin teacher going through college, and I will say her mindset around health has really defined my daily living. And I think when she created her bar program and started taking it onto a social platform, she was able to get within your home and to teach you that health didn't mean that you had to stress over it. Health didn't mean that you had to go into an hour class, pay $20 or above, giant memberships. Health is about your routine. It could be 15 minutes. It could be a simple walk. It could be the food that you put in your mouth. So with that, Erin.
Exactly. Yes.
For our moms on the prenatal side, when they're looking at active programming for physical activity, if that's yoga, Pilates, bar classes, what do you recommend with them shifting in their programming, or do you recommend something completely different?
No, and I think actually it's awesome to keep up your normal routine as far as whatever you're doing before you were pregnant. Try to see as much as you can do during it, just the same way. You don't really want to start a new crazy regimen when you're pregnant, but definitely something that your body is used to doing pre-baby, you can absolutely do during and then postnatal as well. But I think that there are a couple different modifications, and of course, talking to your doctor is first step and making sure that everything's all in line. But you can really do anything that a normal body person can do. I shouldn't say normal body, but you can really do anything that you could do pre-baby. But also, speaking from personal experience, you have to be aware that your body is doing amazing, miraculous things, and take a step back. Don't push yourself the way that you normally could push yourself in situations. Keeping in mind of what is good for your body and what really is not necessary right now. So in terms of strengthening your core, super important to strengthen your back muscles and the surrounding muscles around baby. So think of plank work. Plank work is great, but really crunches are not necessary because you don't really want to crunch that area anymore. So as far as for super simple modifications, no crunches, no laying flat on your back any longer, especially as baby becomes bigger, it can cut off oxygen to the baby. So no lying flat on your back, and no deep twists. So anything with yoga where you're twisting from the side to side, or with weights, if you're rowing, having that rowing motion, those three things are huge. So no laying flat on the back, no core crunches, and no deep twists. And then the fourth thing I would say is always keep water right by you, and take many breaks. And then of course, talk to your doctor beforehand, make sure everything's all good.
That's awesome. Great response.
Thanks.
How can being pregnant can be uncomfortable, getting into new positions, trying to maneuver through a world that you're currently at a different size, getting through this world. If that's getting in cars, going through any kind of environment that you've already been doing, it's going to be different.
Yeah. Turnstiles, like what are the silver turnstiles,
yeah.
You know, the belly gets in the way. Everything's all different.
It's all different.
Everything's all different.
So with that, it's tiring, right?
Yeah.
And it's hard to stay motivated to know that, what should I eat? What should I do? What should I not do? How do I keep I should be active, but I'm so tired right now. What are some kind of tips or techniques that you give to moms with keeping up motivation on why it's important for health and wellness to be at the forefront of their mind?
Well, number one, it's amazing for you and for your baby to keep healthy and keep active. Not strenuous activity, but anything that you're doing that's getting your heart pumping and your blood flowing is good for the baby. And actually, you exercising creates a healthier heart for the baby. So it's kind of almost like the first step that a mother can do to keep the heart as healthy as possible for the baby inside. But also to just keep it simple. Get rid of the judgment on yourself, because it's called like the mom guilt that you'll hear. You'll have it for like the rest of your life now. So just get over it. Like, don't let it don't focus in on that. Whether you're doing the right things or how much or this and that, listen to your body. When you feel tired, rest. When you know that, okay, I can go out for a little walk around the block, go for a little walk around the block. Or, I would love to go take this class, go take a class, or, walk around the block with your significant other. Just any little things that can keep you active, keep you moving, keep the blood flowing. And then you actually might realize, and in certain circumstances, that it'll help with your fatigue. It'll help with that feeling kind of, if you've ever worked out in the really early morning, like the worst part about it is getting out of your bed. Once you're out of your bed and you're actually doing the movement, it's amazing and you feel great. And then the aftermath is what really is amazing as well, because your heart is pumping and you'll feel better. The endorphins, you can't get away from the workout endorphins. They're going to happen no matter what. So the hardest part is just maybe getting out of bed or getting off your couch, or just take that initial step. Don't think it has to be, like you mentioned earlier, it doesn't have to be for an hour. It can be for 5 minutes. And then maybe that 5 minutes might turn into 10 or 15 minutes. So just kind of take it bit by bit. But I think getting rid of the judgment, keeping it simple, and most importantly, this is my bottom line for anybody, regardless if you're pregnant or not, is just finding something you love to do, whatever that may be. Find it so that you come back to it. Because if it's something that you don't love or something you're forced to do, then it's going to seem like work and it's never going to become a habit. So whether that's yoga, whether that's weightlifting, whether that's swimming, riding your bike outdoors or indoors, taking a great class, whatever it is, try a bunch of different things out until it can become part of your routine. And so you actually crave to come back to it and you make it part of your schedule, your weekly schedule. Because otherwise it's kind of like a diet where you've cut out all these carbs, or you're not going to ever stick with it. You're not going to ever come back to it because you're not going to find the joy in it. And I truly believe that when you find your joy in a workout, that's it. You found it, and that's all that matters. So that is huge in finding it just being part of your routine, because it's something that you just need to do, and you crave to do it the next time.
Okay, so I have kind of a personal question for you now. In your experience, and I talk a lot about partnership through creating a baby, developing a baby within your womb, and then labor and delivery and the postpartum side. What was the best, you being married to a very romantic Italian who is very connected with his wife, what was something that he did that really helped you through your labor and delivery?
That's really funny that you brought that up, because I actually had a little note when you were talking. I'm like, oh my gosh, I need to tell her that was so good about what you said about the connection, the connecting through labor. So in our birthing class, they told us, they were talking to the significant other, to the partners. Okay, partner, you need to listen to your wife. If she tells you to be quiet, be quiet. If she tells you to talk, talk. And my husband leaned over to me and said, oh, I know what you're going to ask me to do. And he was assuming I was going to say, just stop talking. Just don't let me just do this myself. And when it was actually in the moment, I didn't want him to stop talking. Okay, honey. Okay, tell me, let's reminisce about our first vacation together. What about our anniversary trip when we went to Cancun? Like, oh my gosh, that was so fun. Or literally just don't stop talking. Don't stop talking. And it was so fun. And he was laughing because he was like, this is not how I expected this to go at all. Like, I thought you were going to tell me to shut up and sit in the corner. But it was so neat. It was like the best day because we just had that connection. And I totally related to what you were saying, because it's so true. Just as much as you want to just grit your teeth and pull your hair out in some moments of that day, finding the connection and finding, again, the joy in the moment, because what you're doing is so special and so something you'll remember for the rest of your life. And I have to say that moment with him, in between like our walks down the hall and sitting on the bouncy ball, him just being there and listening to when I needed him to stop and when I needed him to talk was so important. And that's how it got me through the majority of that day.
He's a good man. He's a good man.
He's a good man. He's a good man.
So I have one more question for you. And that's looking at the transition of the postpartum phase. So as some of you may know or may not know, once mom has delivered baby, she is really kind of in a place of, she's got to be very careful about lifting and carrying this baby because her abs are not there to support the rest of her body. So of course, taking the time that your doctor has requested that you take to not do physical activity is very important. please remember that that placenta within your uterine wall is a very big wound. So you want to really honor that time for your body to heal, and do not put expectations on your body to heal quickly. We like to see moms give themselves the amount of time of a year, and just taking it slowly. But Erin, when she gets to the point of clearance with her medical professional, that she can create this daily routine of activity again, what are some key things that will really help her develop the strength within her mind to connect with what is physically kind of almost shedding off of her body as she is stepping into this motherhood?
That's a great question. Well, I think that, you know, obviously you're going to listen to what your doctor says as far as when you should return back to normal activity. It's different for everybody, but different research shows that, you know, when you stop, because you will be bleeding for a little bit afterwards. So once the bleeding stops and it's continuously stopped, then that you can kind of ease in. For cesareans, it's usually about 6 weeks until you can return back in. But it's all about baby steps. You are not going to go back in full blown to your 6 a.m. spin class if that's what you do beforehand. You're going to go in with baby steps. You're going to go in and take a walk around the block, and you're going to put the baby in the stroller, and you're going to take your water bottle and you're going to put it in the stroller because you need it, especially if you're breastfeeding. You'll get even more dehydrated. So keep that water bottle next to you, but you're going to put on your tennis shoes, and you're going to feel great, and you're going to get some, you know, fresh wind on your face and take a walk. It's really about easing into your workouts. But then, you know, I think that the mind is only as strong as the body is only as strong as the mind is as well. So, you know, keep in mind that stressful thoughts are just thoughts. They're just thoughts. And how to train your mind for what your new life is presenting to you. So I loved having like daily mantras or daily affirmations. That it may sound silly to you if you're not used to, you know, what are affirmations or what are mantras, but they're just like very simple sentences that you can kind of just repeat to yourself. And really you can attach it to any form or any chapter in your life. But, you know, especially in postnatal, or it's more, I am a good mother. I love my baby. My body is doing what it's supposed to be doing. I trust my body. Simple phrases like that while you're taking your walk, or while you're having some time for yourself, or while your baby sleeps, or while you're rocking your baby. But I just think that, again, simple daily habits, once you can get back into it, easing back in, check with your body. How did that make you feel? Maybe do a little bit more. How did that make your body feel? But really just strengthening the mind, knowing that it's kind of shifting. Hormones are a crazy thing sometimes. And trust your body that women are made to be doing this. So your body will bounce back. What somebody did not tell me was your abs, the feeling of your abs not being there. When you're driving home from the hospital with your baby in the back seat and you have all this bliss and your partner is driving you home and you go over a speed bump and your belly like comes up and down off your seat. I don't know. It was the weirdest feeling. So know that your abs will return. Know that your body is meant to do this. Know that you are strong and healthy. And as long as you tell yourself that in your mind, your body will believe it, and you will move forward the way that you're supposed to with your brand new baby in this amazing chapter.
Thank you. That was very good. So I know that we've gone about 10 minutes over, and I want to release all of you to enjoy the rest of your evening or whatever you have planned at whatever time of day that you're watching this. But Erin can be easily accessed from her blog, livinglately.com. Sorry, I got a little off there. And on that blog, on that blog, you are going to find several videos for a workout series. I do them all the time. If it's just a small walk with my dog and then doing 15 minutes of a workout with my friend on my cell phone or on a computer at home, any kind of screen, she'll lead you through 10 to 15 minutes, depending on the workout, all kinds of workouts. And it's something that I enjoy. And she's so likable. It's fun to connect with her, even if I always tell her, I'm like, oh, I was hanging out with you this morning. It feels like I'm hanging out with my friend in my own home, getting a workout routine in. So I highly recommend, check that out. Of course, keep in mind all the things that she reminded you of protecting your own body. And please tune in next week, next Wednesday. We have Dr. Courtney Martin going to help us with, who's also a dear friend of Erin's. And she's really amazing. And she's knowledgeable, and she's head of labor and delivery at her hospital. So please tune in. And if you have any questions, tribedoula@gmail.com, and I'm happy to help you personalize your experience. Thank you, Erin. See you all soon.
Bye. Thank you so much.
Bye.